Hello and welcome. October is Breast Cancer Awareness Month, and I am Dr. Tanya Cook, a member of North Jersey Alumni Chapter of Delta Sigma Theta Sorority Incorporated. And our Physical and Mental Health Committee is spotlighting our featured speaker, Dr. Norma Roberts. Dr. Roberts is the Chief Medical Officer at Alliance Medical Center, a federally qualified health center in Jersey City, New Jersey. Dr. Roberts is an OB-GYN doc and a graduate of Rutgers University Medical School. Without further ado, I present to you Dr. Roberts.
Good morning. Thank you for the opportunity. It's a wonderful time to discuss such an important topic. I appreciate your confidence as well as your invitation, and it's a wonderful to actually connect with you, Dr. Cook. We've known each other for quite some time. And so it's, I want to thank you and your sisters and your chapter for the opportunity and the ability that you're providing me with that. Like you mentioned, breast cancer is one of the leading cancers that affects not necessarily just women, but also men. And it's very opportune time to discuss and talk about a little bit about breast cancer and the detection methods that we have available, and as well as the ability to seek care when it's necessary. Breast cancer is the major risk that we have for breast cancer is basically just being a woman over the age of 50. And definitely there are some family history associated with the development of the disease. We all have heard of the BRCA, BRCA1 and 2 as the leading genetic mutations that lead to this type of cancer, breast cancer. There are some factors that we can modify, and there also contribute risks for the development of the disease. The weight, obesity is one of the risks that we have. And there are things that we can do to change that, not only exercise, but also a healthy diet, as well as, limiting alcohol intake and things like that. Medications, we are in the age of everyone wanting to be and feel younger. And one of the things that we have prescribed, we as gynecologists, obstetrician gynecologists have prescribed for women, especially postmenopausal women, are hormone replacement therapy to deal with some of the risk, side effects or complaints that we have as menopausal events occur. But hormone replacement therapy, especially those that have both estrogen, they do have estrogen and progesterone, are associated with a higher risk for developing breast cancer. Breastfeeding is one of the, or lack thereof, is one of the risks associated with development of the disease, as well as early menarche or onset of your cycles, or late onset of menopause. That because it's a prolonged period of time in which you are being exposed to estrogen. Statistically speaking, I wanted to talk a little bit about statistics. Breast cancer develop approximately 255,000 women a year. And 42,000 of those women actually do succumb to the disease. In that evens out to about 1 in every 8 women is diagnosed with breast cancer. Black women, in our Black and brown women, our risk is higher. In approximately not only of developing the disease, but also 31% higher risk of dying from the disease. And this is significantly higher than any other ethnic group. We can speak about the reasons for that, and many of them have been discussed: lack of access, fear, not knowing your history, as well as issues with weight management, poor diet, and things of that nature. Um, I just wanted to mention also in males, 1 in every 100 is diagnosed with breast cancer as well. So even though we are focusing on women, we cannot forget our men, because the disease, when it's diagnosed in men, is usually more aggressive and is usually associated with a poor outcome. Um, Now, in terms of screening, there are different ways. Um, we all follow different bodies of experts. The US Preventive Services Task recommends the mammograms be done every 2 years, starting at age 50 to 74. The American Cancer Society recommends starting 40 to 49 with the option of having it every year if there is a risk. Um, and after between 45 and 54, that the screening mammogram, which is the test that it is the recommended test for screening, be done yearly, and greater than after 55 years old, the American Cancer Society is recommending every other year or yearly, depending on the conversation between the patient and her provider. The American College of OB-GYN has recommended to start our yearly mammogram if you have average risk, to start at 40. And average risk refers to, if you don't have any family history, if you don't have any history of a genetic mutation, if, all of those, you haven't taken any kind of HRT, hormone replacement therapy, anything like that. Just start between 40, and if not, definitely on a yearly basis by 50. The screening process for breast cancer, in my practice, what I tell my patient is a two-way street. And it places not only the responsibility, but also engages the patient into having something to say about her health. And having said that, we have to encourage, or we encourage patients to do their own self-breast exam. I always say to my patients, no one knows your body better than you. And you are the one person who most likely will detect something before any of us physicians are involved in even trying to figure out what's going on. And so I teach in every patient beginning, we see patients beginning at the age of 18. So every patient beginning at the age of 18, how to do their own breast exam and how to recognize when something is new, or it has not been there before. The breast exam itself, the self-breast exam, should be practiced every month. Ideally, if you're a menstruating woman, ideally a week or two after your cycle, because we all know during the cycle or right before your cycle, your breasts are a little bit more dense or engaged or engorged, and so and tender, so you're likely not to want to do the exam. But usually a week or two after your cycle, it's recommended that you do the test. The test or the self-exam. The exam itself is composed of two different or three different steps. The first one is just visualization. Basically, stand in front of a mirror. You put either your hands up or your hands down, and you look to make sure that your breasts look similar, or there's symmetry between the two of them, and one is not higher than the other or pulled in or things like that, because obviously those are signs that something is not right. And also, you want to make sure that although one side of our body is usually bigger than the other, that they do look almost about the same size. So that's the first part. The second part is you want to then, with one hand behind your neck, you're going to use the fingertips, your fingertips. And when I say this, it's important because the most sensitive part of our hands is the fingertips. you are going to literally walk around the breast as if it was literally just walking, not lifting your hands, because when you lift your hands, whenever you lift your hand and you put your hands down, you never land in the same space. So it's very important that you do not lift your hand and just literally walk like this around your breast in a circular motion. Many of us forget that this part of the breast is called the tail of the breast. So that's your third part. You do this, so one hand with the opposite hand, you do the one breast and then do the opposite. When you get to the nipple, you squeeze the nipple. The discharge of the nipple should be the clear, milky discharge, depending on what part of the cycle you are, or none at all. Any other discharge other than that, greenish discharge, bloody discharge, is not normal. And we need to, seek medical attention right away. The tail of the breast is important because a lot of tumors do hide in that area, and it's not an area that we're used to examine or touch or palpate. So it's important to make sure not to forget that part. Other than that, the most important part is to recognize that our gold standard is the mammogram. It is not a comfortable test by no means. But it's something that we need to do because it is the one that will determine or discover any abnormalities that need further attention. Once the mammogram is done, if there's anything that it needs to be addressed, then we can potentially, send you for an ultrasound, send you for additional testing or more detailed images. But the key to survival in this disease is early diagnosis. Early detection and early intervention is the key to be able to get to appropriate therapy, be it lumpectomy or mastectomy, chemotherapy, and having a good survival rate. That's all I got.
Thank you so much. That was wonderful. On behalf of the Physical and Mental Health Committee of the North Jersey Alumni Chapter of Delta Sigma Theta Sorority Incorporated, I just want to thank you, Dr. Roberts. Once again, this is Breast Cancer Awareness Month, and we wanted to highlight some of the concerns that we should be focused on in our overall health. And with that, I thank you for taking that time to spend with me and my sorors. Thank you so much.
Thank you.
Just 1 second.